We are the People's Parliament and will always identify with the needs of the people and those who are willing to give us a helping hand towards solving those needs. The National Assembly recognizes the importance of collaboration and partnership in addressing healthcare challenges. We are committed to creating an enabling environment through policies, legislation, and funding to ensure that the necessary infrastructure and resources are available for successful organ transplantation programs. Collaboration is key, and we assure you that we are eager to join forces with your association to tackle the complexities surrounding organ transplantation in Nigeria. Because we know you're not finding it easy. Because we know the basic laws are not in place. Because we know it seems to be a new terrain, new space in the medical space. We have to partner with you to make sure that policies of governments and relevant legislations, legislative interventions will be in place to help you serve our people better. I was happy when I heard of the legislation for disease donor, or what you call disease donor legislation. It could be Disease Donor Act, which is going to allow people while they are alive to pledge to donate their healthy organs to save the lives of those who are living. It might be a death through accident, it might be a death through other means that did not affect the kidney. It's happening overseas. But we need to, through public hearing, through various advocacies and orientations, let Nigerians know that if your kidney is taken when you are dead, it doesn't mean that during reincarnation you will come with one kidney. That is a myth that we must resolve through orientation and relevant advocacy. But I know it is achievable if we decide to go that way. And as a member of the House of Representatives and the presiding officer that is interested in health, I will be joining hands with the members to champion this cause. I can assure you that we are eager to do this for the sake of Nigerians. Because I know by combining our efforts, our expertise and resources, we can make significant strides towards improving healthcare outcome and enhancing the quality of life for our fellow citizens. Thank you for forming this organization, Transplant Association of Nigeria. Announce yourself the more so that most young medical officers will embrace it as a field of interest. So that while most of them are thinking of various other parts of medicine that is popular, they will begin to consider this field, because this is a field that has, it's out of necessity, must be embraced by the medical practitioners so that we can bridge that gap that is existing. For your conference, you will interact with our various offices when the notification is fully out. When we receive your letter, we will try and ensure that the committee chairman and membership of the committee in health services and health institutions will be there to attend, or will send you a representative if we are not attending in person. The chairman of health services has just been announced as a minister, but I'm sure there will be a replacement, and we'll give you a formidable team that will partner with you to make sure that the conference will not only be a one-off conference, but it will be the foundation for greater heights for your organization. Once again, thank you for coming.
The reasons why Nigerians go out of the country, and we know that this country is losing at least $1 billion, $1.2 billion every year to medical tourism. And so we want cooperation from the House, especially in the area of the disease donor program that we want to set up. It's part of our agenda. So our conference will hold on the 21st and 22nd. And one of the things that we'll be talking about is disease donor transplants. That is the future of transplantation in our country, as it is in other parts of the world. We are finding it difficult to get Nigerians who will want to go under the knife for their loved ones. You know, it's becoming difficult all over the world. There's scarcity of organ donors all over the world. And so what they are doing in other parts of the world now is to have a disease donor program. And you're aware that for us to do that in our country, there must be some legislative backing. We must have the right laws in place to be able to carry that out. And so, as a member of that committee in our association, I decided to come here to speak to this House and to let you know what our plans are, and to let you know that very soon we'll be coming up with a draft on disease donor organ transplants in Nigeria. That will help resolve a lot of problems that we're having with shortage of organs all over the world. It will need legislation, it will need some form of sensitization with Nigerians. As you are aware, we have a problem here where quite a number of Nigerians think that the power of reincarnation, when they come back to this world, if they donate an organ even when they are dead, they may come back and they may not be complete. And so we need to change this narrative so that people who are living can have an organ transplant done within the country. And as you're aware, the prevalence of chronic kidney disease is on the rise. So there's a need to have such an organ bank where that is done properly and according to the law of the land. You can allocate organs to people suffering from the various diseases that they require one form of solid organ transplant or the other. Also, we would like to invite members of the House to our opening ceremony, which will be on the 21st of the month, 12 noon precisely, and also invite the chairman, House Committee on Health, because we promise that it's going to be a very robust conference that we'll have, where we've invited some of the members of the Transplantation Society, that's the World Umbrella. They will have some of their members around to talk, to give lectures, and then to rub minds with us. So we think that is the right time to do that. And then also finally to solicit for some sponsorship for the program. It's going to be, we will have the conference in the Abuja Continental Hotel, and we want to solicit the House for some funding as well for the association, because we believe that a healthy nation that's the way to go. We cannot be over 200 million people and be relying on somebody out there to solve our health problems. Our health problems must have local solutions, homegrown solutions to our problems, so that when you and I have relatives who may suffer from this disease, they do not have to go outside the country. They can have their transplants done in the country, in country. Thank you very much.